Hi everyone, my name is Bridget Weinman and I completed Role A for this assignment. Our topic is on neurocognitive disorders due to traumatic brain injuries. Neurocognitive disorders caused by traumatic brain injury appear in many different forms, some better known than others. This presentation will provide an overview of TBI and its neurocognitive effects, with links to websites and a video to learn more. We will also discuss a 2017 article that explores the intersection of TBI, depression, and gender. A major or mild neurocognitive disorder, or NCD, due to traumatic brain injury, or TBI, is caused by an impact to the head. The impact to the head can be caused by an injury from an object or a blast injury, which can be experienced by those in the military, and this trauma causes the brain to shift within the skull. Imagine a ping pong ball in a cup. The ball would represent your brain and the cup your skull. If the cup shakes or gets knocked, the ball ricochets off of the sides of the cup. If one's head received an impact, the brain is susceptible to shift within the skull, causing the traumatic brain injury. Before jumping into the DSM-5's criteria for major or mild neurocognitive disorders due to TBI, I would like to explain the criteria specified for mild and major neurocognitive disorders. According to the DSM-5, those who experience major neurocognitive disorders meet the criteria of a significant decline in cognitive function. This decline affects the individual's tasks of daily living. For example, the individual may not be able to dress themselves or forgets how to feed themselves. This cognitive decline cannot be caused by another mental disorder. Per the DSM-5, the criteria for mild neurocognitive disorders are a slight change in cognitive function, and although there is a slight change, it does not keep the individual from accomplishing tasks of daily living like major neurocognitive disorders do. The slight change can cause forgetfulness of daily tasks such as forgetting to pay a bill. Lastly, and similarly to the major neurocognitive criteria, the mild neurocognitive disorder is not due to another mental disorder. Moving on to major or mild neurocognitive disorders due to traumatic brain injuries, the DSM-5 explains there are other criteria one needs to meet in order to obtain this diagnosis. The first criteria that must be met is the individual meets the criteria for either a mild or a major neurocognitive disorder. This would be the change in cognition, how daily tasks are affected, and that there is no other mental disorder that would cause these changes. Other criteria include loss of consciousness, post-traumatic amnesia, confusion or feeling puzzled, and neurological signs. These neurological signs can be seen by neuroimaging that captures the brain injury. This can be done by a CT scan. An example of a neurological sign are the onset of seizures. There are also symptoms that can occur along with neurological signs. These symptoms include depression, headaches, feeling easily irritated, and photosensitivity. This chart was taken directly from the DSM-5 and breaks down some of the criteria for neurocognitive disorders due to traumatic brain injury. In a mild case, loss of consciousness would be up to 30 minutes. A major case would be greater than 30 minutes. And in severe cases, loss of consciousness would be greater than 24 hours. As for post-traumatic amnesia, or the loss of memory, this would occur less than 24 hours from the trauma for a mild case, 24 hours to 7 days for a major case, and for a severe case, post-traumatic amnesia would occur for more than 7 days. A traumatic brain injury can occur to anyone of any age, gender, or race. TBIs do not discriminate. The majority of TBIs are due to falls, but motor vehicle accidents are not far behind. Lastly, sport-related injuries, especially concussions, are another major cause of TBIs. Multiple concussions can lead to more severe cases of neurocognitive disorders due to TBIs. This diagram from alamy.com depicts what happens during a motor vehicle accident. As you can see, the force from the impact of the car can cause the body and head to move forward. When this happens, the brain hits the skull. When the skull stops moving, the brain continues to move within the skull. Each strike against the skull causes injury and trauma to the brain. It is extremely important to receive the appropriate medical treatment after an injury to the head, as neuroimaging will need to be used to capture the injury to the brain. Even after the initial diagnoses, those who suffer from mild traumatic brain injuries can continue to experience a reduction in cognitive function and the inability to perform tasks once used. For those who suffer from major traumatic brain injuries, they may continue to experience inability to independently provide self-care, have a decrease in motor skills, experience symptoms of depression, aggression, and the inability to control their emotions. In the next slide, the video will introduce the story of a woman who endured 3 traumatic brain injuries during one event, and how detection of the TBI was crucial to her recovery. You will also hear about the different symptoms that she experienced, and you will hopefully be able to pick up on the DSM-5 criteria that I mentioned in this presentation. I hope you learned a lot about traumatic brain injuries, including the criteria noted in the DSM-5, but also the importance of receiving medical attention after any trauma to the brain, as this diagnosis can be life-altering. Thank you.